Welcome back to Washington Watch. Joseph Backholm sitting in for Tony. Now, last week, the CEOs of American Airlines and Southwest Airlines, two of the nation's largest airlines, told the Senate Committee on Commerce, Science, and Transportation that there is a very strong case that wearing masks on planes don't do much to limit exposure to COVID. Those comments, of course, were not received well by some, including Dr. Fauci, President Biden's chief medical advisor, who was asked yesterday on ABC's This Week about when masks might no longer be required on airplanes.
They were suggesting that there really isn't much of a need for a mask on an airplane. Are we going to get to the point where we won't have to wear masks on airplanes?
I don't think so. I think when you're dealing with a closed space, even though the filtration is good, that you want to go that extra step.
While masks might be an extra step, are they a necessary step or one that needs to be mandated? Are they even a significant step? Joining me now to talk about this and more is Dr. J. Bhattacharya, professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration, a statement advocating an alternative approach to the COVID-19 pandemic. Dr. Bhattacharya, welcome back to the program.
Great pleasure to be here.
Well, I've got a lot I want to talk to you about, but we're going to start with the comments there from Dr. Fauci, the prospect that masks are an extra step that may always be helpful.
I mean, if you look at the evidence about ventilation, especially in places that are excellently ventilated like airplanes, that is a far more important intervention than the mask that you wear. The typical masks people wear have no evidence at all that they stop the spread of the disease or protect the person wearing it from disease, especially like the cloth masks. And so I think this idea that it's necessary as an extra step, I think it doesn't make sense. It doesn't correspond with the scientific evidence actually saying, especially the randomized literature about masks. In this case, the CEOs are right and Dr. Fauci is wrong.
Do you think it's too much to say that some, and perhaps Dr. Fauci, are generally unconcerned with the trade-offs in this discussion, unconcerned with the economic, emotional, psychological impact of these decisions, and singularly focused on the health impact?
That's entirely true. He in particular, and much of the public health class that's been running the lockdown focused strategy that we've been using, seem utterly blind to the collateral harms of the policies that they put forward. You mentioned economic harms. Let's leave those aside. Let's just talk about the public health harms. You know, women are showing up with late stage breast cancer this year because we closed elective treatments last year. They should have been caught with mammograms last year at an earlier stage. They're going to die thanks to the short-sighted policies. Tens of millions of people around the world have been thrown into poverty and dire food insecurity because of the economic harms of lockdowns, especially in poor countries. I think this is one of these things that has been bugging me the entire epidemic. Public health is more than just about a single virus. It's about the entirety of health of the population, and much public health has lost sight of that.
During the hearings last week, Senator Ed Markey, Massachusetts, he also made a moral argument, but he made a different moral argument. He criticized the remarks of the airline CEOs. I want to play a part of his response to you and then get your responses.
Right now, there are tens of thousands of people flying who are unvaccinated today on planes in the United States. And it's unfair to people who are vaccinated to have them sitting next to them with their masks off. It would be wrong. It would be immoral to ever take that position.
What do you think about the idea that it would be wrong and immoral to allow maskless people to be near masked people on airplanes or the unvaccinated?
Well, I mean, I think that kind of politics is itself, I believe, immoral. It's a politics of division, and it is not rooted in the scientific facts. The vaccine is a fantastic tool to protect you against severe disease if you should get COVID. It works incredibly well for that. I mean, I personally was vaccinated in April of this year and then got COVID in August. And it was it wasn't the most pleasant experience, but I wasn't hospitalized. And of course I didn't die. On the other hand, the vaccine does not stop disease spread. That is abundantly clear. We're seeing highly vaccinated states see major outbreaks. We see highly vaccinated countries see major outbreaks. The vaccine then, therefore, is not some categorical thing that makes you clean, which is the premise of the remark by Representative Markey. In fact, the idea of clean and unclean has no place in public health and in no place in public health policy. And I think if you're going to talk about what an immoral policy, discrimination against the unvaccinated, I think falls into that category. They're not categorically higher risk to anyone than the vaccinated are.
You note there that the vaccine is incredibly effective at reducing the impact of an infection, the severity of it, but also that it does not stop the spread. Is that something that we've learned over the last 2 years? Because if memory serves, there was this hope that the vaccine was actually going to stop the spread.
Yeah, this is one of these things that we have learned. I mean, this is in January of this year, in reviewing the data that from Pfizer in their randomized trial, I thought that the vaccine would stop disease spread and stop infection, or sort of greatly reduce the risk of it. What's come out over time from a whole series of really fantastic studies done in places like Qatar, Sweden, Denmark, even in Northern California, these cohort studies we tracked over time, turns out that vaccination by itself does not stop disease spread. In fact, vaccine efficacy against getting infected peaks around 2 months after vaccination, at about 70% efficacy against infection, and then drops sharply so that by 6 or 7 months, it's down to maybe 20% efficacy and maybe lower at 8 months. So the vaccine doesn't stopping you from getting infected, but what it does do, as you said, is that it protects you against severe disease. It'll make it so that when you get sick, when you get infected, you have a less severe outcome, sort of a less severe disease, and that's actually, I mean, that is the right basis to tell people to take the vaccine. It will protect you, unlike masks, against severe disease.
So if a vaccine does not stop the spread, how should that change our current policies?
Well, this push to ostracize the unvaccinated, to force them by coercion, by taking away their ability to work, their ability to go to restaurants, to public libraries. I mean, that needs to end immediately. It is not justified by the science, and I believe it's just immoral. I think the idea that the vaccine is that somehow if we vaccinate 100% of the population, then the disease will stop is a false notion. We have no technology of stopping disease spread. This disease will continue to spread, will continue to circulate in human populations forever. Actually, not just in human populations. This infects basically a very wide variety of mammals. There was a sero survey in the U.S. that 80% of white-tailed deer have antibodies to COVID. So I think this is one of these things where we think we have a control over something we actually do not have control. There's an illusion of control over the spread of this disease. I think the vaccine mandates are a sort of a symptom of this, that we've fallen into this illusion of control over this disease because we're so scared of it. But in fact, the right policy is encourage people to get vaccinated because it will stop them from getting a severe disease if they were to get infected. It should not be to try to stop the disease from spreading altogether because we just don't have the technology to do that.
Do you think, with respect to the virus, which has now gone through at least 2 variants that we've been very publicly aware of, Delta, now Omicron, are things ever going to be substantially different than they are now? Is there going to be a point at which there are no more cases where we've generally developed the immunity and this is just not something that anybody is talking about anymore? No,
this disease will spread around forever. The herd immunity means a sufficiently large fraction of the population is immune, not that the disease such that the disease doesn't spread exponentially. Well, I mean, that could happen. That will happen eventually. But that doesn't mean the disease is gone. It just means it comes back every season. We'll have from now until forever a COVID season where the disease will spread. But it's not anything to fear because at that point, in the future, hopefully very soon, a sufficiently large fraction of the population has already experienced the disease and recovered, so they're protected against severe disease, or they're vaccinated and protected against severe disease. So the COVID becomes something we can manage, a risk that we can manage, rather than something we should fear and completely change our lives around.
How far away are we from that point? Because at the beginning of this entire episode, I think I heard numbers of somewhere between 70 and 80%. Once 70 and 80% of the population has antibodies, that's the point at which we've developed some form of herd immunity. That's basically the best we can hope for. It'll be under control, but always with us. Where are we at now compared to the best case scenario?
I mean, I don't know the threshold such that the disease is above the herd immunity threshold. I don't think anyone knows that number. It's a seasonal disease, so the herd immunity threshold is not a fixed target. The herd immunity threshold will be higher in the winter during COVID season, or the fall during COVID season, and lower in the summer. And it'll depend on the region you're in, right? So southern regions seem to be affected earlier in the year. So it's not that you have a fixed number and you're done with the disease. The question is, what fraction of the population is still immune naive? What fraction of the population neither has the immunity induced by the vaccine or by COVID recovery? And that fraction of the population, I believe, is shrinking very rapidly. I mean, it's unfortunate that the CDC doesn't track these numbers or attempt to track these numbers systematically like some other countries do. But in other places, it's upwards of 80% of the population already have already had either the vaccine or a natural immunity from COVID recovery. I mean, the U.S. could be in that range. We don't have a good number for in the U.S., but it wouldn't surprise me to know that we were somewhere in that range. Again, that doesn't mean the disease doesn't spread. That doesn't mean you can't get the disease. And it also even doesn't mean that you won't die from the disease. That's possible, especially if you're older and immunocompromised. I mean, respiratory viruses, unfortunately, kill, including things like the flu and even common colds, kill older people all the time, especially older immunocompromised people all the time. It's just, but it's not something that we sort of restructure our entire society around trying to avoid, simply because we do not have the technology to avoid it. We don't know how to stop these diseases from spreading.
Let's talk about Omicron for a moment, because there's mixed messages. Some are saying this is the best thing that's ever happened because it's going to give everybody immunity and it's very minor. Some are saying it's about to overwhelm the hospital system. What do you think we should believe about Omicron?
Well, if you look at the data out of South Africa and out of Denmark, it's actually pretty encouraging. It looks like that that people who are infected with Omicron, again, adjusting for age of the population, they get a milder outcome, less likely to be hospitalized, less likely to need oxygen, less likely to die from the infection than if they than the previous variant, the Delta variant. So, I mean, in that sense, it's good news that we have a milder variant floating around. It does also seem to be more transmissible. So the things that you thought were protecting you are less likely, all else equal, to protect you from catching the thing in the first place. As I've been saying all along, we don't have a technology to stop it, and Omicron just makes it more the case that we don't have a technology to stop it. Is this good news or bad news? I think it really depends on how large a fraction of the population is protected by some form of immunity. So either natural immunity from COVID recovery, being young by itself provides some protection. Children already have very mild diseases, even with the earlier variants, for instance, and for the vast majority of them, and then or the vaccine. I mean, all of those things provide some degree of protection. In that sense, since Omicron is less severe, that's, to me, good news.
You mentioned that youth itself is a kind of protection from the coronavirus. Do you recommend the vaccine for young people?
I mean, I think that should be a decision you make between the pediatrician and the parent, right? It would depend on the particulars of the kid. I mean, I can think of cases where a child has severe chronic diseases or is immunocompromised in some way where it makes some sense to vaccinate. And I can also think of cases where a child doesn't really need it because they're a healthy child, and if they were to get infected, they would have a mild disease. And there are side effects from this vaccine. Especially boys seem to have higher risk of myocarditis if you were to get one of the mRNA vaccines. And so, I think this ought to be a private medical decision that parents make with the pediatricians, not something that's the central focus of public policy.
Now, very quickly, a more personal part of the story for you. Over the weekend, the American Institute for Economic Research released an email exchange between Dr. Fauci and NIH Director Francis Collins that said they attempted to coordinate a, quote, devastating takedown of the Great Barrington Declaration, of which you were a part. What was your reaction when you saw that?
I was disappointed. I mean, I think I've long admired Dr. Collins. And to see that the head of the National Institute of Health would engage in essentially a propaganda smear campaign against me and my colleagues, is incredibly disappointing to see. To me, it says a few things. One, he lies about the proposal. We argued for focused protection of vulnerable people in the Great Barrington Declaration. He characterized it as a proposal to let the virus rip in society. That is false. We did not propose to let the virus rip in society. In fact, we proposed specific measures to protect vulnerable people, and particularly older people who are have this risk of severe disease if they were to get sick. That was in October of last year, and yet he mischaracterized, and he organized a media campaign to continue to mischaracterize it. I mean, and I felt the brunt of that over the past year.
Dr. Bhattacharya? Unfortunately, I can't let you finish your answer because we are at a hard break and we are out of time. I knew I was going to run out of time with you, and we have, but we greatly appreciate you being with us, as well as your courage on this issue. Thank you so much.
Thank you. Nice to talk.